Well, now for part one of a special report on plastic surgery. The focus, a little-known facelift technique. News 12 Connecticut's Gillian Neff joins us now. She was in the operating room, and she has the full details. I don't know if we want all the details.
I'm telling you, this topic is such a conversation piece. People like to talk about it. The whole idea of getting plastic surgery to look younger stirs a debate. And the patient we followed right into the operating room certainly debated herself before going ahead with surgery. Here's why Carol Dowd ultimately decided to go ahead with it. She was recently divorced, conscientious about her health, her family, and just about every other aspect of her life, and she decided it's not a crime to want to look a little younger for her 60th birthday. So here it goes. But before we roll tape, if you don't like graphic surgery video, turn away right now.
But I like art with people in it because I'm a people person. This picture I gave to my son as a birthday gift.
Beautiful images are everywhere in Carol Dowd's life.
I'm starting to get excited. I am getting excited about it.
She's a jewelry designer with an eye for fine art and an appreciation for fine artists. To her, that includes Westport plastic surgeon Dr. Joseph Brad O'Connell.
The whole thing's an artistic judgment anyway. And she has what we call mid-facial descent, which is what we all see in the mirror every day when we get in our 40s and 50s.
Carol is looking to Dr. O'Connell for a more youthful look, just a few weeks before she turned 60.
At first, I didn't feel so good about being the birthday girl.
Her gift to herself? A fairly new cosmetic operation few people know about, Mini-Facelift.
A short scar facelift gets about 80% of the correction with about 50% of the scar.
Okay. Let's have some Zephyrin, yes.
The real breakthrough, the Mini-Facelift does not require the cutting seen here in a different OR. See how the traditional full facelift entails cutting extensively behind the patient's ear and into the hairline?
The real advantage of a short scar facelift is that all the scarring behind the ear and into what we call the posterior hairline back here is eliminated.
I'm really excited about it.
You all set?
All set.
All right. Hair's done. I'm ready.
Carol goes into the OR deeply sedated.
We, number one, release the skin's connections to the underlying tissue. There's a piece of anatomy that we now know called the malar fat pad, which we didn't even know existed 10 years ago. And the malar fat pad, we know, sort of slides down or falls down as a result of gravity as we go through midlife. And one of the things that we're going to do today is we're going to relocate that malar fat pad up on the cheekbone.
Once those main facial structures are lifted, the skin is redraped and the excess skin is cut away.
Then at the end of the procedure, when I've already lifted the mid-face, I'll go ahead and then take out the extra skin in the lower lids.
After 4 hours, Carol is finished with surgery. She's had her lower eyelids lifted, then the main part of the surgery, which was the mini facelift. In addition to that, she had some resurfacing done of her upper lip to remove the fine lines. The mini facelift comes with a trade-off, though. The skin on Carol's neck will not be improved in keeping with her face. For that, she would have to go the full facelift route. While the operation's over, Carol doesn't expect to look 20 after this, but she is hoping to look like a better version of herself, more well-rested, just in time to face the big 6-0 with renewed confidence. You know what we've got for you tomorrow. The results will show you how Carol looks, and you can decide if it was worth it for her. Now, Carol has a better knowledge of plastic surgery than most non-doctors because she works part-time in Dr. O'Connell's office, but she does urge other people considering a mini facelift or another procedure to do their homework on the procedure and the doctor. Make sure your surgeon is board certified, and you can get that information by logging on to news12.com and clicking on numbers and links. You can get access to the American Board of Plastic Surgery website. Of course, it's a personal decision, and many people choose not to. I know my mother would be cringing. She thinks it's all nonsense, rolling her eyes.
Yeah.
Well, to each his own.
To each his own. Do you want to know, are you going to talk about pain tomorrow? How painful it was?
And recovery? Or was not.
Or was not? Okay. And how much it costs.
You got it.
All right. Okay. We'll see you then. We want to know.